Hi, and welcome to Prescription for Medication Education, where I like to talk about medications and health-related topics. I'm a pharmacist, and I've been making videos on here for about a year now, and I decided I wanted to do something a little bit different today. So I decided I wanted to do some calculation videos, today being my first one. So bear with me if I make a couple mistakes along the way. And the way I'm going to do this video is I'm going to teach it in a way that even my middle school age children can understand what's going on. So with that being said, let's go ahead and get started. Let's pretend that you're the pharmacist working and you get a prescription for baby boy with the date of birth of November 10, 2025. The medication is Cefixime. It's a concentration of 100 milligrams per 5 ml. Okay, as you can see, this is our medication bottle over here. It's Cefixime oral suspension, and there's 100 milligrams per 5 ml. All that means is that for every 5 milliliters of liquid, there is 100 milligrams worth of medication. The doctor wants the baby to have 6.8 milliliters by mouth, that's what the PO stands for, twice a day, that's what the BID stands for 5 days. The doctor wants us to give a total of 68 milliliters. So anytime we get a prescription for a baby in the pharmacy, it's really important for us to get the weight. If we don't have the weight, that just causes all sorts of delays and trouble for us. Number two, we want to know what the indication is. Why do we want to know the indication? Because some infections require higher doses than others. It's that simple. And there's a lot of thunder in the background. And ideally, number three, we don't always get, but it's nice to have, is a target dose. So what is the dose that the doctor is hoping to achieve? Okay, so let's call the doctor's office, and once we do that, they let us know that the child weighs 20 pounds. Awesome. Step one is done. Step number two, we call, and when we call, they let us know that it's for a UTI. Awesome. Step number two is done. For number three, we weren't able to get a target dose from the staff. So we don't know what the doctor is trying to achieve here. We have enough information to at least get started. So we know that the child weighs 20 pounds. And we have to know that 1 kilogram is equal to 2.2 pounds. Okay? And this is called dimensional analysis. It's just a method for us to convert units into other units. So here we can go ahead and cancel out our pounds. And so that'll leave us with an equation that looks like this. 20 times 1 kilogram over 2.2. All right. And then all we do here is we multiply the numerators. So we have 20 times 1, and that is equal to 20. Beautiful. We can't forget our units, so we just plop that down in there. And then, put that back in there. And then 20 kilograms divided by 2.2. That gives us 9.09, yada, yada, yada. All right, we'll just round that off to 9.09 kilograms. All right, so now we have step number one. We have the weight of the child in kilograms. Okay, and then now we go to step number two, which is the indication. So for a UTI, urinary tract infection, LexiDrug tells us that the recommended dosing is 8 milligrams per kilogram per day, with a big emphasis on day. We don't want to confuse day with per dose, because that can lead to medication errors. All right. So just like we did earlier, we're going to use dimensional analysis once again to solve our problem. We rewrite our child's weight, but now we have it written in kilograms, and we're going to use our recommended dosing, which is 8 milligrams per kilogram per day. And just like we did earlier, we're going to cancel out any units that we can in the numerator and denominator. So kilograms goes away. And now we're left with 9.09 times 8 milligrams per day. Okay, and will it calculate this for us? It will. Beautiful. So we know that this child should get a total of 72.72 milligrams per day. That is total. We don't want to go over that. Okay. And I forgot to mention earlier, did I mention this earlier? No, I didn't mention it. And we want to always look at the maximum recommended dose per day. That's something that we have to keep in mind. So the maximum recommended total for Cefixime for a child of this age and weight is no more than 400 milligrams per day. And as we can see, we're well under that. So we don't have to worry about going over the recommended maximum per day. Now let's go back to our original prescription. Our original prescription stated we want to give 6.8 mLs by mouth twice a day. Okay, so if we're giving 6.8 mLs by mouth twice a day, and the concentration of the medication was 100 milligrams per 5 ml, we're gonna go ahead. Wow, there's a lot of thunder in the background. We have 100 milligrams per 5 ml. That's how the medication comes. And same thing we did earlier, we're gonna cross out our units and we just do our multiplication. So numerator times numerator, 6.8 times 100 milligrams equals 680 milligrams. 680 milligrams divided by 5. That gives us 136 milligrams. But this is per dose. Every time we give 6.8 milliliters, we are giving 136 milligrams worth of medication. And remember, we're giving this dose 2 times a day. So 136 times 2 equals 272. So at the way the prescription is currently written, the baby would get 272 milligrams per day, which is way different than our recommended dose of 72.72 milligrams per day. The doctor's dose is 272 milligrams, and our recommended dose is 72.72 milligrams. This is a difference of about 3.74, which means that this dose is about 3 to 4 times higher than we expected. If we want to see what the current milligram per kilogram dosing is, all we have to do is take the total amount of milligrams that the patient's going to receive, which is 272 milligrams per day, divided by the child's weight, which is 9.09 kilograms, which gives us an answer of 29.92 milligrams per kilogram per day. We can just round this up to 30 milligrams per kilogram per day. So we can see that this is definitely different than the suggested 8 milligrams per kilogram per day. Now we can go ahead and just call the doctor and find out what is the target dose that they want. Okay, I'm just gonna go ahead and end the video here. Thank you so much. Have a great day, and please feel free to comment down below.